And welcome to our weekly COVID-19 update number 105 for the town of Plymouth. I'm Steve Triffletti, Plymouth Town Moderator. We're here each Wednesday at noon for this update. This forum is being brought to you live by PAC TV on Comcast Channel 15 on Verizon Channel 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. Now, for questions during today's forum, please email us at plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today's participants include Plymouth Representative Mathew Muratore, Plymouth Board of Health Chair Dr. Barry Potvin, and we also welcome back Michelle Bratti. She's the Director of Elder Affairs for the town of Plymouth. And we're going to begin, as we've been doing each week, with our health segment. And once again, we welcome back Dr. Barry Potvin. He's a Professor Emeritus for Yeshiva University, the Department of Biology. Barry, a lot is still going on as we update the town of Plymouth.
Yeah, thanks, Steve. Boy, you don't have to tell me that. It takes a lot of time to just keep up with everything that's changing so fast. I'm going to go directly to the screen share so that you can follow along as quickly as possible with me. And I need to go to. Okay, you should all see the slides now, I hope. So this is the data that we gathered as of yesterday at 1:47 p.m. Again, it just shows you the increasing numbers of cases and deaths in the US and in Massachusetts. It hasn't been going up that fast in Massachusetts, and as you can see in Plymouth, it's still just 151 deaths, has not altered in months, but we are seeing some new cases. I should point out that our public health nurse reported just for yesterday's numbers that there was 35 new COVID cases here in Plymouth. We haven't seen that since April 6th, so that's kind of scary. The mortality rates that you see are just to give you an indication for comparison's sake that it is much more deadly than the influenza was. This is the usual chart. The good news here is if you look way over on the right-hand side, it looks like in Plymouth, the average daily cases has sort of leveled off. It's pretty much stayed flat. I'm hoping it stays the same for the next week, but we'll see tomorrow night. This is a new thing that I found online. It gives the hospitalizations, and you can see that in Plymouth County, so this is not just for our local hospital, but all hospitals in Plymouth County, new admissions have gone up 58%. Percent of beds used have gone up a little bit, and the number of ICU beds used has also gone up a little bit. Matt may be able to give you information about BID Plymouth. It's a little bit hard to come by, but we should have that for you at some point in the next few days. This is the new cases in Massachusetts. So again, it's statewide, but you can see we're still on the uptick in terms of the number of new cases that are appearing. This is another little promising piece of news. It's done for Plymouth County. And you can look and you can see that the weekly COVID cases in Plymouth County has gone up. It does show the flattening. And when they use statistical modeling, it looks like it has in fact been flattening out. So that's good news. This is the transmission risk criteria that's used to designate whether or not counties and states are high risk for transmission risk, substantial or moderate or low. And as you can see, Plymouth County is now at 149.85. Obviously they're still in the high group, and town of Plymouth is still the same. So this is the colored map that shows you what's going on in Massachusetts. The orange ones are the substantial risk. And as you can see, that has been gradually becoming less and less and more going into the high risk groups. Over here, it just tells you the 10 counties that are considered high risk at the moment. This is for the United States. Last time I showed you this, Maine was still orange, but now everyone, welcome to the club. Everyone is considered high risk for community transmission. These are our vaccination numbers that came out last Thursday. and was for the vaccinations as of the 24th of August. And if you look down here, you can see that 69% of our population here in Plymouth is fully vaccinated. And that's taking away, again, the people that are not yet eligible for vaccine, which are the ones that are below 12 years of age. In terms of the ones who are not doing so well compared to the state criteria, the 12 to 15 year age group is about 13% below the state average. The 16 to 19 age group is about just 1% below the state average. This group is actually 9% below the state average, and this group is about 14% below the state average. But much to the delight of, I'm sure, Michelle and everyone else that we know who are senior citizens, we have an awful lot of our senior citizens fully vaccinated. And you notice that if you look at one or more doses of the vaccine, they don't give you the numbers, but it's well above 95%. So again, the Delta variant is causing us problems. You need 90 to 95% fully vaccinated to stop the spread of this Delta variant. The United States is 52.4, Massachusetts is 65.6, and Plymouth is 61 at the moment. Provincetown, this just changed yesterday. They did have an indoor mask mandate in place, but because the cases are improving, they just changed it to an advisory. And again, down here, you see another criteria that's used. And Plymouth County would still be considered necessary having a mandate. Town of Plymouth is just below that cutoff. There's some common questions that come up. I'm not going to go through these in great detail at the moment because I put these up just in case somebody actually sent in a question. But I will be going over these in some detail at the next Board of Health meeting. They pertain really to face mask protection. You notice that studies show that they're 79% efficient at preventing spreading of the virus via respiratory droplets to other people around you. I'm going to skip through some of these other things. I wanted to mention ivermectin. This is, as you can see, a veterinary antiparasitic drug commonly used for livestock, should not be used to treat or prevent COVID-19, according to the FDA. It has been used sometimes by people to treat parasitic worm infections, head lice, and scabies. The virus is none of those, obviously. In clinical trials, it failed to help those infected with coronavirus. When it's purchased at livestock supply centers, it results in calls to poison control centers. And the FDA stated, mostly I think for people in the southern part of the country, you are not a horse, you are not a cow. Seriously, y'all, stop it. So they're trying to put the brakes on this. There's some other questions involving monoclonal antibodies, as you can see, and some questions about pregnant and breastfeeding women, but I'll go through those at the next Board of Health meeting when I have more time. So I'll stop the share and answer any questions that anybody has that comes in. Thank you.
Thank you, and that's Dr. Barry Potvin. He is chair of the Plymouth Board of Health. You can send him your questions to plymouthinfo@pactv.org. And at this time, we welcome back Michelle Bratti. She is the Director of Elder Affairs for the town of Plymouth. She's at the Center for Active Living. Welcome back, Michelle.
Well, hello, friends. It's certainly great to see you all again. Thank you so much to PAC TV, Matt and Steve for hosting this amazing, informative panel and inviting me back as a guest. It's always an honor to be part of this awesome community collaboration. Well, the Center for Active Living has certainly been busy since the last time I was here. We are fully operational with our front doors unlocked and ready for you to come on down. Masks are required in our facility, regardless of vaccination status, per the town mask mandate, but that has not stopped our patrons from enjoying all the wonderful programs available, as well as the ability to finally socialize with friends. We encourage you to drop in and see all that we have to offer in our spacious building. We are very proud of our senior population. As Barry had mentioned, the vaccination rate for Plymouth seniors is in the high 80%, and I believe that chart just said 86% of being fully vaccinated. We are so proud of you. We have a few great events coming up at Cal that I wanted to share with you. We have a free 3-part health fair series on Thursday, September 9th, September 23rd, and October 7th from 1 to 3 p.m. each of these days. We think it's important not only for COVID, which will be covered, but also in general. We kind of have learned over the last year and a half or so that we really need to take care of ourselves, mind, body, and spirit, and we want to keep that sentiment going. We'll be featuring traditional medicine, alternative medicine, and nutritional vendors from our community. This event is being brought to you by the Cal Advisory Board Community Committee. Businesses participating include Triple M Dispensary, Beth Israel Deaconess, Plymouth Board of Health, and Cinderella Massage, just to name a few. See, we want you to take care of yourself. This is a drop-in event, so please come by and check it out. At the September 23rd series, we will also be introducing Select Board member Harry Helm to our seniors. Harry was designated the Cal Select Board Liaison, and in this role participates in our monthly advisory board meetings to gain an understanding of senior needs in our community. Harry will be at Cal the 4th Thursday of each month at 1 p.m. to discuss your concerns and issues, including the pandemic, COVID in your town, as well as talk about town government. So make sure you stop by Cal each 4th Thursday of the month to chat with Harry. The other special event is Senior Appreciation Day at Cal on Wednesday, September 15th. That's a week from today. Last year, the sacrifices made by our seniors due to the pandemic and consequential extreme senior isolation status, the Select Board proclaimed September 15th of every year moving forward as Senior Appreciation Day. Last year, we held a drive-through parade. Matt was present right here at Cal. And this year, we'll be celebrating in person at our center. It feels so good to say that. We invite you to stop by Cal between 10 and 3 to enjoy us celebrating you. We plan to have no-charge demonstrations of our most popular health, wellness, and art classes so that you can try something at Cal and see if you have an interest in it. Check out an art class, check out a yoga class, see if you like it. And that way you don't make a commitment and enjoy it. And if you love it, you make a commitment to come back. We will also be having fun throughout the day with try your hand at cornhole, giant-size lawn games for fun, and a barbecue time grilling up some great hamburgers and hot dogs. There is no charge for any of these events, and registration is not required. That's the first time I've probably said those words. We simply want to celebrate and honor you on this day. So plan on stopping by with your friends to join in on the fun. We uphold COVID cleaning protocols at Cal always. Know that you're going to walk into a building that is safe, and we're all masked. So come on down. Thanks, Steve.
Thank you, Michelle Bratti. She is the Director of Elder Affairs for the town of Plymouth, and she's here to answer your questions. Send them to plymouthinfo@pactv.org. And at this time, we welcome back our weekly regular, Representative Mathew Muratore. Welcome, Matt.
Hey, Steve, how you doing? So before we came on the air, it was just announced that the Baker-Polito administration is going to be asking the Public Health Council to approve a mandate for vaccines for those employees who work in rest homes, assisted livings, hospice programs, home care workers. A couple of weeks ago, we had Bob Eisenstein on talking about nursing homes where those workers have been mandated to get vaccinated as well. So it looks like the goal is really here to try to protect all the seniors in the Commonwealth. So if the Public Health Council will approves this, which I assume they will, that will take effect.
We lost the audio.
Sorry, gotcha.
There we go.
That will take effect on October 31st if the Public Health Council approves that, which I believe they probably will. Now, going back, looking at some of the numbers, looking at what Dr. Potvin showed with regard to vaccinations really coincides with the cases of the age group of people that are actually still getting COVID. The older you are, the less likely you are getting it. The breakdown of the last 2 weeks of those getting COVID, over the age of 80 in the Commonwealth, there was a little less than 400 people that received COVID, and that coincides with what Dr. Potvin showed, that the majority of our older folks in the Commonwealth are vaccinated. When you look at the 70 to 79-year-olds, a little less than 700 people got COVID-19 in the last 2 weeks. Then it starts going up a little bit. 60 to 69 is 1,200. 50 to 59 is almost 2,000. When you look at the 40 to 49, it's 2,100. 30 to 39, that's 3,100. 20 to 29, 3,600. And then under the age of 19 is almost 4,000 cases of COVID in the last 2 weeks. So, the vaccines do help with this tremendously. So, also just wanted to tell you too, Steve, that we did break the 26 million mark in testing over the past week. So there's been over 26,000 tests of COVID-19 that have been performed here in the Commonwealth. Yesterday alone was 63,000. So our testing capabilities are going back up again as well. In the last week, there was 3,700 breakthrough cases, and that's cases of folks that have been vaccinated but still came down with COVID-19. And there were 7 more deaths of those breakthrough cases as well, and another 75 more people in the hospital. That brings the 7-day average positivity test rate to 2.61%, which is a little bit lower than it was last week. But just keep in mind, it was once 30% back in April of last year. So still a far cry from where we were. We've also gone over the 700,000 mark with regard to COVID-19 since March of 2020. We're at 700 and almost 10,000 confirmed cases of COVID-19 here in the Commonwealth. The death toll, as Dr. Potvin indicated, is still rising. It's rising slowly, but it looks like, unfortunately, we're probably going to, in the Commonwealth, reach the 18,000 mark of confirmed cases. What Dr. Potvin, when in his numbers, refers to as probable cases. I report the ones that are the confirmed cases. Right now, we're at 17,874 deaths in the Commonwealth since we started. In the next 2 or 3 weeks, we'll probably be over that 18,000 mark, unfortunately. Hospitalizations, as Dr. Potvin indicated, are still a little bit on the rise, slightly from last week, a little less than 600 in the Commonwealth right now being reported as hospitalized. Again, far less than the 4,000 at the height of this back in May of 2020. Of those, 168 are vaccinated, but still are hospitalized. There's 163 that are in intensive care and 100 that are on ventilators. With regard to the vaccinations, we have 9.2 million people have been vaccinated as of yesterday, with 4.7 million people with the first shots. And the total vaccinated folks are 4.5 million. So we reached the 4.5 million mark, which is about 65%, as Dr. Potvin indicated, of the population of Massachusetts that is eligible. When you take out the under the age of 12, it becomes well over 70% of the eligible population that is vaccinated. And we're still going strong with vaccinations. So that is the update that we have for today, Steve.
Thank you. And that is Plymouth State Representative Mathew Muratore. Next week, our special guest will be Michael Jackman. He is District Director for Congressman William Keating's office, and he'll be here to join us to update us on what's happening at the federal level. At this time, we're going to be going to some of our questions. And the first question that we have is again for Dr. Potvin. And Barry, viewer asks, how is Beth Israel Deaconess in Plymouth holding up at this time with the increase in COVID cases?
Yes, thanks, Steve. Our local hospital is doing quite well in comparison to what's going on in other parts of the country. I believe, if I recall the numbers correctly, that they have, I think, 9 COVID patients in the ICU. So that's a significant number for them. And again, it's a fairly low number in the hospital. the hospital beds are probably 90 some odd percent taken, but there's a very small fraction of people in those hospital beds at the moment at BID Leahy Plymouth that are COVID patients.
Thank you. And the second question from a viewer, again to Dr. Potvin, how accurate are the home testing kits which have results that come in 15 minutes?
Well, they are certainly not as accurate as the molecular PCR tests, which are mandated for backup in case you have positive test result from a home kit. You would probably have to get the PCR kit. I can't give you a specific number. A lot of the problem with the home test kits are they're not necessarily that easy to use properly. And if you don't do them exactly according to the instructions that come with them, they could give you false negative or false positive tests. But in terms of just a routine screening, they're certainly pretty easy to use, and they are relatively inexpensive. I think they're about $25 a kit from CVS.
Thank you. And again, you can send your questions to PlymouthInfo@pactv.org. I did want to announce and a little personal privilege out of an event that I am sponsoring in 2 weeks from today. And it is going to be a gathering where we're scheduling it outdoors in order to be mindful of the concerns of COVID. We're also asking people who attend that they be vaccinated, or that if they have a medical issue, that they have a COVID test where they are negative. That event on September 15th is a brain aneurysm awareness after hours. Today is the start of Brain Aneurysm Awareness Month. Many of you may know I did have a brain aneurysm 4 years ago. I was fortunate to have successful surgery to treat it, and but this will be an opportunity to not only create awareness, but to support the Brain Aneurysm Foundation. And this year, there has been a chair of research that has been created by the family of Johnny Hackett. Johnny Hackett passed away from a brain aneurysm at age 3 earlier this summer, and all the proceeds from our event will be for the Johnny Hackett chair of research. So again, a gathering outdoors where we are asking people to be vaccinated or to have been tested if they have a medical reason where they can't be vaccinated. At this time, we're going to be going back through our panel and invite each of them to give us their closing thoughts for today. And again, we'll begin with Dr. Potvin.
Thanks, Steve. I guess one thing I should point out is I believe today is the first day of school here in Plymouth. And certainly our thoughts are with them. And we're hoping that everything goes well. I'm sure it will, because I have great trust in the school officials. In terms of watching out for things, we still need to be vigilant. It's quite obvious that the pandemic is not over, although it's worse for those who are not vaccinated yet. Our public health nurse reported that on the 27th of August, we had 130 active cases in Plymouth. The next 2 days over the weekend, it was 145, and yesterday it was 156. So we have to be cautious. We have to be vigilant. We'll get through this eventually, but it's taking a little longer than all of us certainly hoped. So the best thing to do is to be careful and certainly do everything you can to take care of yourselves, your family, and everyone else around you. Thanks, Steve.
Thank you, Dr. Barry. Potvin is chair of the Plymouth Board of Health. He's also Professor Emeritus, Yeshiva University Department of Biology. At this time, we return back to Michelle Bratti. Michelle, what should we think about today in connection with COVID and our seniors?
You should think about your seniors every day in this town, because they predominantly are one of the largest populations, right? I think the themes that we have expressed, all of us, in so many different ways, whatever your community role is, we need to be mindful that our seniors have taken due diligence and taken the responsible road in order to become vaccinated so that they can enjoy the quality of their life. If you think about a senior's quality of life, you envision them having worked a full career, maybe raised a family, done something that has been an accomplishment. It is their time to enjoy life. So it goes back to the notion of, if you don't consider taking the scientific precautions for yourself, please consider taking them for those that have earned the right to enjoy the rest of their lives. I will tell you, just as a final thought, I am beyond pleased to share that on August 17th of this year, the Plymouth Select Board voted unanimously to create a senior needs evaluation task force. And this groundbreaking initiative is the first of its kind in the town's history. This new initiative invites feedback, transparency, and collaboration across Plymouth Town departments, committees, with businesses, citizens groups, health perspective. We're talking about COVID, that will be relevant here, and individuals on items relating to senior needs and best practices. This task force is being formed to study broad picture fundamental issues and implement solutions of a best practice nature that benefit our seniors. It's about time we came to the forefront. Considering that almost a third of Plymouth's population is 55 plus, we are proud that our select board is making an investment in understanding the importance of senior needs and senior strengths. It's not just needs-based, it's understanding where our strength lies in this community. If community members have an interest in serving on this task force, you should and can contact Chris Bedeau at Town Hall directly. His number is 508-747-1620, and Chris is at extension 10106. Thank you, Steve.
Thank you, Michelle Bratti, Director of Elder Affairs, Center for Active Living. And now we close out with a closing statement from Representative Mathew Muratore. Matt.
Yeah, Steve, thanks. I just want to go off what Dr. Potvin said about being vigilant with vaccinations. I had somebody mention to me the other day that they didn't want to get vaccinated because even people that are vaccinated are still getting COVID. You know, those numbers in the Commonwealth are very small, though. You know, there's almost 20,000 people out of the 4.5 million vaccinated people that have got COVID after being vaccinated, and that's a 0.0001%. And the hospitalization and deaths are even less than that. So still contact your primary care if you have concerns about the vaccination. But obviously, from the numbers I read earlier, with the amount of folks that are getting COVID, obviously the more folks that are being vaccinated, the less the chance of the virus actually spreading. So continue to be vigilant on that, and we'll see you next week.
Yes, thank you. You will see Matt Muratore next week. He'll be hosting since I will not be here next week. And each and every week, we couldn't do this without the support of PAC TV. And today in studio with me, we have Kim Myatt, who's here as the floor director in the studio, and also in the booth, Nate Greenstein. We thank them, thank Julie, who's the executive director, for all of her support and the support of the entire PAC TV team. Again, a reminder that Plymouth Town Meeting is the third Saturday in October, and I've determined that that also will be virtual, so it'll be carried live on PAC TV, and town meeting members will be participating with the Zoom video conferencing platform, as well as support from OTI Technologies. Thank you for joining us. Please join us again next Wednesday. I'm Steve Triffletti, Plymouth Town Moderator, and good day.